As with other biomarkers, such as afraid biomarkers, it's important to recognize that imaging biomarkers also have inherent limitation in sensitivity and specificity. Even in tests with relatively high sensitivity and specificity, such as amyloid PET, the positive predictive value may be low if performed on a population with a low greatest probability of the diseases. Even in patients being considered for treatment with elevated targeting drugs, it's crucial to first establish a suspicion of Alzheimer's disease as an underlying pathology. This should be based on a comprehensive clinical evaluation, including a detailed medical history, neurological examination, and neuropsychological testing, followed by blood tests and MRI to rule out treatable dementia before proceeding to amyloid PET. While amyloid PET strongly supports the presence of a certain threshold of amyloid beta accumulation, such findings may reflect incidental mixed pathologies, particularly in elderly patients. Thus, diagnosis should be approached from a multidisciplinary perspective.
I agree. It definitely takes a multidisciplinary approach. And I think that some of the core messages that I always take away when I think about imaging are the fact that we really need to be efficient. We're going to be identifying most of the patients with cognitive impairment. Y'all are incredible specialists, but patients aren't going to be coming to you first. We're going to be seeing that in our clinics. And I think it's really important that we do the assessment clinically. We look at other factors that could be affecting cognition, such as medications, lifestyle, etc. And then we start up with some laboratory tests and, very importantly, a brain MRI when at all possible. And that just makes things so much more efficient.
When it comes to clinical utility and clinical and interpretation of results in the clinic, I think the disease stage makes a huge difference. So, and in terms of patient counseling, if someone has full-blown dementia, and a positive amyloid PET scan, the situation may be very clear. Of course, this is still an important piece of information when it comes to selecting individuals who are eligible for treatment with a disease-modifying drug. But as we move into earlier and earlier stages, I think it becomes more tricky. We want to identify pathology in pre-symptomatic individuals, and that's where the relevance of a positive amyloid PET scan becomes a little bit kind of unclear, and patients want to know, how long do I have? How long will it take me to progress to dementia? I barely have any symptoms. I have a positive PET scan. So these are challenging conversations that we have to get used to in the near future, I think.
I would also add in the space without a national health service and payer, this is the most expensive test option that I have, and that's also that major side effect, if you will, to someone's savings account. It is covered in very, specific situations. And I think that, of course, gets into then very thoughtful and appropriate use, both clinically and based on sort of guidelines and how payers will see it. That said, is also gold standard. I think more people are starting to think about it in that way.